Glad to be here. I appreciate the invite to come and speak to you folks about heart health. All right, that's what we're talking about today. So, as you would imagine, as a physical therapist, background in exercise and mechanical therapy, my field that I would consider myself an expert in is mostly revolves around movement and how movement relates to whole body health, and we can certainly connect that with heart health. And as we also, I think we all realize that the body, it works as a unit. So if we're talking about heart health, we're talking about cardiovascular health, we're talking about whole body health. If we're going to have a healthy digestive system, we've got to have a healthy cardiovascular system, immune system, respiratory system. Everything's connected, and I think you'll see some of that in some of what I've got to talk about today. Interactive. If anybody wants to stop me and ask a question or anything at any time, please. I think interactive is always better. I'll try to leave some time at the end for any questions. The first part of what I'm going to talk about, I'm going to probably try to move through fairly quickly because I think it's going to be a little bit some of what you already somewhat know and have probably heard. I might have a couple of different ways of looking at things, but I'm going to move through that fairly quickly and try to get into the latter half of what I'm going to talk about. I think might be where I can offer maybe something new, or maybe just simply a new way of looking at a couple of things. But again, if anybody wants to stop me and ask or comment or anything, please feel free. Okay, we're going to pass that. All right, so we've heard the statement that that movement is medicine. That's true in the sense that, and that's really what I do on a day-to-day basis. We use movement to address issues, problems that people might be having, whether it be joint pain or whether it be deconditioning or issues with the respiratory system or their heart. Movement is a little bit more than that. Also, I think there are some underappreciated aspects in addition to being a reactive tool to use to help people deal with problems they might have. Movement is also preventative. It's a way to maintain health and prevent issues from coming up, but it's also predictive, and I think that's one area where I don't think it's quite fully appreciated. There was a study, if you'll flip the slide, this was pretty interesting. I think this came out in 2022, and it was a pretty simple setup. They just had some biostatisticians from Johns Hopkins University and Colorado University that studied several factors, and they analyzed some stats, and what they came out with was eye-opening. What they actually concluded was that the amount of physical activity that a person gets in a typical day is more predictive of how long they're going to live than any other aspect. So how much physical activity a person gets in a day was more predictive to how long they were going to live than even their age was, if you can kind of wrap your head around that. It was more predictive as to whether or not they had a diagnosis of cancer, whether or not they had a diagnosis of heart issues. So we need to kind of analyze how people are moving, how much people are moving, not just as a way to treat, as a way to prevent, but also as a tool to analyze, what a person's health status is. There was another study. The American Heart Association did a study and put out a statement back in 2016. They called for respiratory fitness as measured by VO2 max. So basically the max amount of oxygen that you can put out when you're exercising. They called for that to be used just as often as we measure cholesterol and measure blood pressure, because again, they found that to be very predictive of a person's overall health status and predictive as to whether or not they were going to end up having heart issues. Now, in practicality, that's difficult because getting a VO2 max is not easy. But anyway, the idea was that we need to think of movement as a tool to predict. Put that slide. And one thing that I hope to get to toward the end of the exam is not just how much we move. How much we move is important. The quality of movement is perhaps just as important. maybe even more so. There are some other studies I didn't cite that I've just read over the last several years where they're looking at a person's ability, for example, to do basic functional movements, whether or not a person can get up and down from the floor, whether or not a person is able to walk in the community without falling down, go up and down a flight of stairs without using a handrail. Those functional movements are also predictive as to how many health events they might have, how many sicknesses or illnesses or injuries that they might have, and also, again, it seems to be predictive into longevity as well. All right, so this is the section that I want to try to get through pretty quick. So there's several issues that can go sort of off with our cardiovascular system, and there's more than what I'm going to be able to get to here in an hour. But I think we can look at heart problems, cardiovascular issues, in three primary categories that people more commonly deal with. The first one we have here, of course, is coronary artery disease. We all know what that is. That's the issue where those arteries up close to our heart, that our heart, it pumps the blood to the body, but also as an organ, it also has to receive a blood supply. It has the blood brings those oxygen, brings the nutrients, and clears waste. The heart, just like all other organs, has to have that. So if those arteries bringing the blood back to the heart, if they're starting to get blocked through that process, atherosclerosis, where our blood vessels are getting obstructed, that's what leads us into issues where we might have a heart attack, or where we may need stent placement or bypass surgery or something of that nature. I mentioned atherosclerosis. That's at the heart. So that's at the heart of what we're seeing with coronary artery disease. That's the process where we have the bad cholesterol that is hitting those scars. We get scars and damaged sections in the blood vessels. And those scars, those damaged sections of our blood vessels, they will cause those sticky LDL bad cholesterol particles to stick. Those cholesterol particles are sticky to other cholesterol particles. So as we have those cholesterol start to build up, they're sticking to each other, then we start getting these obstructions, and we start getting diminished blood supply, coronary artery disease, okay? So we also have heart failure, also known as congestive heart failure. Basically, the heart's not pumping hard enough. The heart has weakened, and therefore, it's got a big job. The heart has got to pump the blood all the way down to every organ, all the way down to our toes, and all the way back up to our head, our brain, and back up to our heart as well. And if our heart is weakening for various reasons, then that process starts to back up. If we're dealing with heart failure, where that issue comes in is in that return. So the blood is going out, but then that return back up to our heart is where things are kind of backing up, and that's when we start to see the leakage. The blood and the fluid that's trying to come back up is staying there so long that it's actually starting to leak out of our blood vessels, and that causes that swelling, that edema that we see in the feet, in the lower legs. You may even see that in the hands at times, and that's where we'll also see that fluid build up around the lungs, which leads to one of the classic signs of congestive heart failure: the shortness of breath, inability to stand up to exertion, get tired really quick. And another classic sign would be when a person is trying to lie down flat, they can't breathe. They almost feel like they're drowning because they actually are. That pulmonary edema, where again, those blood vessels, that fluid is leaking out of those blood vessels around our lungs. There's fluid building up there, so when we lie down flat, that fluid spreads out and obstructs our ability to breathe. If a person comes and says, I can't, I have to sit up at night, I have to sleep in a recliner, or I have to prop myself up, I can't breathe, that's a classic sign that we're dealing with some heart failure issues. So, these two heart problems, congestive heart failure and coronary artery disease, there's a big overlap there, almost a symmetrical overlap if we're looking at risk factors for these two problems. We're familiar with these, sedentary lifestyle, excess body weight, poor diet. I think y'all heard a lot about diet earlier this morning. I heard smoking, cholesterol, as I mentioned, high blood pressure, poor stress management. Genetics, family history. On purpose, I made that smaller, and I did that because we give it too much credit. It's there. It's there. It's real. If we have a family history of heart disease, and that means that we need to be aware of that. But in helping people over the years, I've found that sometimes that causes people to want to give in. They decide that, well, this is just something I'm stuck with because it just runs in my genes, therefore there's nothing I can do about it. That's a bad mindset, and it's really a misunderstanding of how genetics work. We get our genes, of course, and some of y'all know about what I'm getting ready to say, but we get our genes from our parents. And once upon a time, before the 90s and early 2000s, we thought that was a exact science from what our genes are to what we're going to be in terms of our health and in terms of other issues. As we, in the 90s, you may or may not remember the big project that we spent hundreds of millions of dollars on and brought all the scientists in, called the Human Genome Project. And that was the project where we brought all these people in to map out the human genome, and the idea that we were going to find all of these ways that we can manipulate health, and we can make people healthier, and there was really some strange ideas about what the scientists thought possibly they would be able to do. But there was a big surprise. At the end of that decade-long study, that Human Genome Project, and this is interesting, go back and look it up, but the scientists were left scratching their heads because they found out that genes are not what they actually thought. We inherit our genes, but the fact is, we control. So rather than our genes being an exact cause in what we're going to be health-wise, what we actually found is that we control our genes by way of turning them on or off. So all of our genes are either turned on or off. Not all. You can't turn some of them. Our eye color, we can't turn that off. Our hair color, we can't turn that off. There's some genes we can't turn off, but a lot of our genes in terms of predisposition to heart disease, predisposition to cancer, things of that nature. If I live a healthy lifestyle, my parents died in their 60s of heart disease, but I don't smoke, and I exercise, and I eat a good diet, and I drink plenty of water, and I do all the right things, there's a good chance that I may have that gene, but I keep it turned off throughout the course of my life. And that's why genetics, family history is on here, but don't give it too much credit. Give yourself the power over your own health. All right, so then, a third heart issue that we commonly see would be the cardiac arrhythmia. Of course, the heart has its own machinery that helps it serve as its own generator. So the heart is able to, as we know, is able to create its own electrical impulse, and not only is it able to create that impulse, but it's able to be reactive. So we have a generator that can react to internal or external stimuli, and therefore increase, speed up or slow down based on what the demand is. If we have cardiac arrhythmia, something's gone wrong with that internal machinery, that electrical machinery, and all of a sudden we've got a heart that impulse is not controlled really well, and we're either beating too fast, or we're beating too slow, or we're beating irregularly. There's several different types of arrhythmia. One of the more common you hear about is atrial fibrillation, so that little fibrillation of the atrium trying to get the blood down through the ventricle, causing it to back up. That can lead to blood clots and strokes and things of that nature. It's connected to the other two categories of heart problems that I mentioned, in the sense that if we have an arrhythmia, that makes us more vulnerable to those other two issues, coronary artery disease and heart failure, and vice versa. So if we have coronary artery disease and or heart failure, that also gives us a higher risk of developing a cardiac arrhythmia. So because of that, because there is that connection. There's an overlap of those risk factors. Those same risk factors that we named for the first two, they're risk factors for cardiac arrhythmia for the simple reason that those two issues can lead to cardiac arrhythmia. However, cardiac arrhythmia also has its own separate list of some risk factors that are a little bit different. We see these here. A little bit too fast there. So respiratory issues. So if we have any sleep apnea issues, or if we have COPD or something of that nature, that places us at a higher risk of having some arrhythmia issues. Excess caffeine or other stimulant can make us more vulnerable to developing arrhythmia. Excess alcohol intake and poor stress management or poor sleep habits. Those are risk factors that can make us more vulnerable to cardiac arrhythmia. And again, those are a little bit more unique to that particular heart issue. Now, here's a point I want to make about these heart problems and about these risk factors. And you've already heard this to some extent. If we're having some issues and we go to our doctor and we say, doc, I'm having whatever, I'm having chest pain, I'm having shortness of breath, I'm having some type of problem, and the doctor decides that we're having something going on with our heart, with our cardiovascular system, for the purpose of stabilizing that entity in the acute, that doctor needs to give us a diagnosis. He needs to come up with some explanation as to what's going on, so that he can provide some immediate intervention as to what needs to be done to correct it. So in that sense, in that immediate, there is value in the doctor deciding, okay, your problem is a result of congestive heart failure, or your problem is a result of coronary artery disease, your problem is a result of you're going into atrial fibrillation or what have you. The doctor is going to provide an intervention, whether it be a procedure, whether it be a medication, or some other type of intervention to stabilize the issue that you're dealing with. Once we get past that immediate need for a specific diagnosis, therefore a specific intervention, then I don't think it's as valuable to separate these cardiovascular, these heart issues, into these separate categories. I think it's more valuable to ask myself, is my cardiovascular system healthy, period, rather than looking at a specific diagnosis. And the reason why is because all these risk factors and all these heart problems that can come up, they're all connected. You can sort of envision a wheel, as you see here, and you can jump in at any point on this wheel and you can start connecting dots. In my opinion, this is more valuable than looking at heart issues in terms of risk factors. We need to be aware of risk factors. We need to be aware if we have them, and we need to be aware of the fact that leaves us vulnerable. However, in my experience, working with patients for 17 years, if I'm explaining a problem to a patient, it's more useful if I can give that person a direct cause and effect. If I tell that person, hey, your knee hurts, here's exactly why, and therefore we need to do this to correct this knee pain, that person's going to buy in. Now, if that person comes in and they say, my knee hurts, and I say, well, do this, and I don't give any explanation as to why they're doing this or why their knee hurts, they might participate, they might not, they might half participate. If a person really understands how to connect those dots, so why does sedentary lifestyle lead to coronary artery disease? Why does a poor diet lead to heart failure? Why does poor stress management lead to these issues? If we can really connect these dots and understand what's going on, I think it empowers us to really know how to basically reverse the wheel. So, just for an example, y'all bear with me on this. Go back. So if we jump in at any point on this wheel, and I'm going to jump in at a sedentary lifestyle, and I'm going to connect some of these dots for you. I just want you to sort of hear how we get cause and effect. So if a person is sedentary, what we know is that there's an increase in buildup of bad cholesterol in the blood vessels, because the cholesterol without physical activity is not cleared as readily. In addition to that higher level of bad cholesterol, we also have a tendency to maybe have a little bit of excess body weight. Excess body weight causes us to carry, I'm sorry, go ahead.
Oh, no, I didn't mean to interrupt you.
That's all right.
Okay, I work from home, and I think a lot of us work from home. So should we try to like exercise for a certain amount of time every day?
Yeah.
Or, because I'm starting back exercising recently, actually, and I'm doing it like to start off like 3 days a week. Because I don't want, I felt like my joints getting stiff and stuff, like, because I'm just like not getting the proper amount of exercise. So if I work from home and I'm at a desk most of the day, what is the proper amount of exercise that I need?
Yeah.
To avoid the sedentary lifestyle?
Yeah, good question, and that's the issue that we're dealing with a lot, and we're living in the computer age, and when it comes to physical activity, that's putting a lot of us at a disadvantage. And a lot of us have jobs that require us to sit and require us to be fairly sedentary for a lot of hours. So we're dealing with that. We're seeing that more and more in healthcare, and that's a good question. So we basically we got to find our time. The American College of Sports Medicine makes a couple of recommendations. One is about 30 minutes of moderate physical activity, exercise 5 days a week, or about 20 minutes of vigorous physical activity 3 days a week. That's the recommendation, as you'll see later in the slide for from the American. And here's the good news on this. It does not take much to start making a difference. So if we're going from, yep, I'm working hard, I'm at a computer, I'm sitting long hours, I don't have that much time, I'm busy, we're busy. That can be a barrier mentally. It's like, how do I get started? If I get started, I'm nervous, I'm not going to have the time. I encourage you by saying this, it doesn't take as much as you think. Study after study after study has shown that even 15 minutes of physical activity a day makes a huge difference. So just start somewhere, even if it's 10 minutes, just get up, just walk, just anything, do some stretching exercises or whatnot. And as you start to reap the benefits of that, it's going to become addictive. It really is exercise, and the way you're going to feel, you're going to like it, and you'll probably start finding other little times during the day, during the week, and be a weekend warrior. A lot of times during the work week, we're busy. So on a Saturday, the weather's nice, get a little bit extra. There are studies that have also shown people that work long hours and have really limited chances of exercise during the week, although it's ideal to get that 5 days a week in. Some people really have a hard time, so when you get that Saturday or that Sunday, get out, walk, do a little bit more. You can make up for some of what you lost. Is it complete makeup? No, but you can make up some just by being that weekend warrior that's going to really hit it hard on the weekend. Does that answer your question? Yes, ma'am. So if we do have a sedentary lifestyle, then as we were saying, that's going to lead to higher cholesterol. That's going to lead to higher inflammatory markers in the bloodstream. Now, those inflammatory markers in the bloodstream, that's one of the things that injures our blood vessels. So our blood vessels actually get little tears and little cuts, which, as we talked about earlier, leads those cholesterol to start to stick and build up. We develop the atherosclerosis. So the blood vessels are narrowing. That narrowing of the blood vessels, that's going to raise our blood pressure. So the heart has to pump harder through tighter space. It's like putting the thumb over the end of a water hose, and that pressure goes up. It's the same thing in our blood vessels. If our blood pressure goes up, then that the blood with those inflammatory particles are hitting the blood vessels harder, and we get more injuries. We get more scars. We get more cuts to those blood vessels. So the whole thing starts to kind of feed itself. So let's say we're developing some coronary artery disease, so therefore we're getting a decrease in blood supply back to our heart. Therefore, our heart is starting to have some damage, and it's starting to sort of get a little bit weak. It's starting to get stressed out. that's the point where we start to, and again, the heart also pumping against that high grade, against that high pressure, causes the walls, the muscle to actually stretch. As those walls and muscles stretch, we start to get a weaker pump. That's what leads us into heart failure issues. As the heart is working harder and it's having to pump harder to push against that tighter grade, it stretches the muscles beyond what they're supposed to be, and we get a decreased contraction, so we start to develop some issues with heart failure. Heart failure further causes us to be tired, excessive fatigue. We can't be as active. The whole system, what I'm getting at, as you can see, this is a snowball down a hill. We start somewhere with something that causes us to start to have some issues, and as those issues mount, it starts to create other issues, and it's all connected. The cardiac arrhythmia, just to finish connecting the rest of the dots here, if our heart, if the muscle, the myocardium is getting stretched out and is getting damaged, those electrical components in the heart, they're also getting damaged. And that's where heart failure has a tendency to lead to more issues with arrhythmia. And then, of course, arrhythmia makes a weaker contraction, and the whole thing keeps on feeding itself. So that's the problem. Now we can give better news. Let's start talking about the solution. So if poor heart health and poor cardiovascular health is this issue that feeds itself and creates more problems because it's all connected, the opposite is true. If we start to do things right, we start to correct some things, and as one aspect of our cardiovascular system, or in a larger sense, one aspect of our body starts to get healthier, that improved health starts to cause the good ripple effects in the other way. So that whole feeding itself in one direction can be reversed. Now, there are a lot of things that we need to do to have better heart health. Like I said, I think you heard this morning about diet. Diet is very important. We've got to make sure we're eating the right things. Stress management is very important, and if I get a chance, I'm going to touch a little bit on that. Sleep is vital. We could have a whole symposium on that and how important sleep is, but I won't go there. But I'm a little biased because I'm a movement guy. That's what I do day in and day out. That's where I'm an expert. I really feel like movement can be a key to this thing and getting this thing turned around. And I'm going to give you some ideas of why I feel that way. All right, so some of you have probably heard of the principle of overload. The principle of overload is one of the first things that you're going to hear about 101 in your most basic exercise science classroom. And I'm going to describe how that goes. It's pretty simple. So if I want my bicep to be stronger, the principle of overload says that I need to place a higher demand on that bicep than what it typically will do. So if I take a dumbbell and I start to curl that dumbbell and I do it enough times, what I'm actually doing is I'm overloading that muscle, and by overloading it, I'm basically breaking it down. I'm damaging the muscle. So when you go to a gym or you go somewhere and you exercise or you lift weights, what you're actually doing is you're creating some micro damage to the tissue. What your body does in response to that, in response to that micro damage to the tissue, it says, okay, we got to do something. We got to go in. We got to repair this damage that's been done. So when the body goes in to repair that damage, it's going to do so. It's going to fix what was torn, but the body is smart. The body's going to say, well, if he's going to keep doing this, if he's going to keep building and pumping that dumbbell, then I'm going to do something to make that muscle better so that if he does that again tomorrow or the next day, it's not going to tear that muscle down like it did this time, because I don't want to have to keep going in here and repairing this thing. So the first thing that my body is going to do is it's going to make more motor units, which is just basically, it's going to create a stronger connection to my nervous system. So therefore, my nervous system has increased ability to tell my muscle to contract. So let's say that's all taken care of. The body did that, it recovered, and it created those increased motor units. Let's say I go in and I start curling that dumbbell again. If I curl that dumbbell 5 more times this next time, well, I've overloaded the muscle again. So I've gone beyond what I did the previous time. So this time the body's going to come back in. It's going to start working to repair that tissue. And it's going to say, well, you know, I've already maxed out my motor units. I did that last time. So this time, let's see if he's got a little extra protein lying around. Let's go to the digestive system. Has he had any good quality protein today? Yeah, had some chicken for lunch. So we're going to get that protein. And we're going to actually, this time, we're going to stick that protein into that muscle that he damaged by lifting that dumbbell. And by adding that protein, we're going to actually increase the size of those muscle fibers. So therefore, if he's going to keep going and curling that dumbbell, we're going to have a stronger muscle that can withstand that. That is exercise science 101. That's the principle of overload. The reason I bring that up is because every aspect of the human body works that way. Every one. Principle of overload. So when you hear doctors encourage us, for example, as we get older, to avoid dementia and things of that nature by challenging our brain, by doing puzzles, by problem solving, by being engaged in the community, by challenging your brain, you're overloading it and you keep it strong. Same thing, you can look at the immune system. So the reason why when babies are born, we don't put them in a bubble, because it'll kill them. They won't develop an immune system. So what we have to do is we have to let those babies come into the world, and they have to be exposed to germs. Yeah, it's sad to watch the little child get sick and whatnot and have the sniffle and the cold, but by doing so, that immune system starts to develop and it gets stronger. Respiratory system works the same way. Our joints work the same way. Every aspect of the human body works on the principle of overload. Our body responds to the demands that we put on it. Now, I'm going to take that same principle and I want to apply that to healing. And this is getting into what I do on a daily basis. So, I'm going to give an example, and then I'm going to come back and I'm going to connect it back to what we're talking about. We're talking about the heart today. But let's say somebody comes in to see me when I get back to the office today, and let's say that I assess that and I diagnose that shoulder pain to be a contractile tissue dysfunction. So that means that there's damage to a muscle or a tendon, and therefore that's causing that person to have pain. Let's say that person shows me, hey, Michael, when I raise my arm, when I do this, it hurts. And I've assessed that to be because there's damage to a muscle. Well, what I know as a physical therapist is that to get that to heal, we've got to go through the 3 phases of healing. So when somebody damages a tissue, the first thing that happens is the inflammatory phase. So that's the body's Band-Aid system. The body's going to go in with those inflammatory particles. It's going to clean out the debris. It's basically get the car accident off the road, make sure everybody's safe. We're not in immediate danger here. Lay down the Band-Aid, clear out the waste, and let everything settle down a little bit. That inflammatory phase of healing should run its course in about 3 to 5 days, maybe sometimes a little bit longer. After the body's gone through that inflammatory phase, we're going to get into the healing phase. The healing phase is going to last a couple of weeks, again, maybe sometimes a little bit longer. That process is going to be the body going in and saying, okay, we got to go a step further than the Band-Aid. That's where the body's going to start laying down the scar tissue. So I've got some damaged tissue, I've got an injury here, and my body is now going into the healing phase to lay down a scar tissue, something that's actually going to hold a little bit better than that Band-Aid was that we put down with that inflammatory phase. Now, without our input into this process, many times the body does not get all the way through that healing phase. Sometimes it does, sometimes it doesn't. But without our input, the body will not go into the last phase of healing. It won't do it. The last phase of healing is the remodeling phase of healing. So I've got the inflammation, I cleared out the damage. I've got the healing phase, I put in the scar tissue. But what my body really wants, instead of that damaged muscle being repaired with scar tissue, it wants muscle tissue back there. That's what's supposed to be there. And as long as that's scar tissue and not muscle tissue, there's going to be dysfunction. And that person is going to come to me and, hey, physical therapist, it still hurts when I do this. It still hurts when I move my arm because it's not muscle tissue. The remodeling phase of healing is where the body actually goes in and turns that scar tissue back into the tissue it's supposed to be. It won't happen unless we drive it. So when that person, now this is the strange part. You've heard the story about the guy that goes to the doctor and says, Doc, when I do this, it hurts. And the doctor says, don't do it then. I'm the opposite. I'm the opposite. That person comes and says, hey, it hurts when I do this. Guess what I'm going to tell them? All right, then I want you to do that 10 times about every 2 to 3 hours. What do you mean? It hurts to do that. All right, let's try it. I want you to do 10 of these. 10, we're doing 10 of these, and the person will say, yeah, that hurts. Yeah, it hurts. Every time it hurts, okay? Stop. Does it still hurt? No, it's fine. So, by the fact that it doesn't continue to hurt after we've done 10 times means I'm not damaging it. It just hurts because I'm loading a tissue that's still pathological, a tissue that hasn't healed properly. What that person's going to do, if they follow my instructions, they go home and do that 10 times every couple of hours over a few days, what they're going to realize is, that doesn't really hurt that much anymore. They're going to come back to see me that next time and say, my arm feels better. It's not as painful. It's still not quite right, but this exercise you gave me, it's gotten kind of easy. It doesn't really hurt that much anymore. And guess what I'm going to do? I'm going to say, all right, well, here's a band. Now I want you to do it against this band. Well, that hurts again. Yeah, we'll do 10 of them. Yeah, that hurts though. That hurts. Okay, we'll stop. Does it still hurt? No, I'm okay. Now I want you to do 10 every hour with this band. So we're applying that principle of overload. We're going back and we're overloading this damaged tissue for the purpose of driving this remodeling phase. Unless I tell my body that I want that muscle back, I want that tissue back healthy, it won't do it for me. That's the way the body works. Why does it work that way? I don't know. That's the way God made it. But it will not heal all the way unless we make it. Going back to the heart. So, we talked about these different ways that we can have damage to our cardiovascular system. We talked about the stretching and the damage of the myocardium, the heart wall. We talked about the injury that happens to our heart with a heart attack or with a blockage. So I'm not getting blood flow back to my heart. I have a heart attack, or maybe it doesn't have to be a full-blown heart attack, just angina. And that's going to damage that heart tissue. So I've got damaged, injured heart tissue because of this heart issue, this heart disease that I've developed. I've got damage to my blood vessels. I want those tissues to heal just like I want that person's shoulder injury to heal. But the same principle applies. That heart tissue, those blood vessels can heal, they will heal. The body is great at healing. It's made to heal. But it's not going to do it unless we drive it to do so. So we've got to apply that same principle of overload to our weakened, damaged heart system. So if we're going to overload heart and the blood vessels, we're going to do it through movement. We're going to do it through exercise. What kind of exercise we're going to use? Well, lots of types are good, but really specifically, if we're getting really specific about wanting to load the heart, what we've got to have is what's called cardiorespiratory or aerobic exercise. So, cardiorespiratory or aerobic exercise is the exercise that causes our heart to beat faster. All right, so if I start to move, or if I start to run, or I start to jog, or I start to do anything, my body has to generate energy to cause my muscles to be able to work and cause my body to be able to function at a higher rate. For the first 3 minutes of my continuous motion, I'm going to go through 2 methods of generating energy that don't involve oxygen. The first is the creatine phosphates. That's my explosive. That's going to last about 20 seconds or so. For about 20 seconds, I can run as fast as I can across to the parking lot. And I'm not going to have to use any oxygen to do that. That's not aerobic exercise. That's anaerobic exercise. It doesn't require oxygen. Then, once that's used up, once all that creatine is used up for about 20 seconds, my body's going to go into glycolysis. So it's going to start to use glycogen from my muscle stores and from my liver or whatnot. It's going to break those down into glucose, and it's going to use that to generate energy. That's going to carry me, if I want to continue running or jogging at a pretty good clip for about up to 3 minutes, that's going to carry me. But if I keep going, I can't go at max pace. We can't keep going at max pace, because those first two systems that are used for max pace and maximum exertion, they're going to be burned out. So if we're max pace, we're stopping. We got to catch our breath. But let's say for 3 minutes we use moderate pace and we push past those first 3 minutes. So we push past those first two systems of energy production. Now I've got to get into the oxidative form of energy production. Now my body has to start using oxygen. I've switched into aerobic exercise. So in a nutshell, aerobic exercise is continuous motion, typically whole body is best. So we're talking about walking, we're talking about a bike, we're talking about an exercise bike, we're talking about an elliptical machine, we're talking about jogging, we're talking about continuous swimming, we're talking about a continuous form of dance, we're talking about unstopping, sustained movement. And as we get past those 3 minutes, we switch into aerobic exercise. We have to have oxygen to produce that energy. So guess where the oxygen comes from? It comes from blood, which is going to make our heart work harder. Once we have to have that oxygen, now we've got to have more blood, because the blood is what carries the oxygen. So now my heart says, all right, I got to kick into gear, because now he needs oxygen for what he's doing. And once that heart has to work hard, that's my heart doing like my shoulder did. My heart is damaged, but now my heart is actually exercising. If I've got some underlying heart disease, or I've had some issues, and I start to engage in aerobic exercise for the purpose of loading my cardiovascular system and loading my heart, well, that can start at a low level. It should. If we overdo it early in the process, then we're going to probably, just like I can't give that person with the shoulder injury a 10-pound dumbbell and say lift it, because if I do, I'm just going to further damage the muscle. So we're going to start out easy. We're going to start out with 10-15 minutes of continuous motion. We have to monitor our symptoms. We have to monitor, how short of breath we're getting. We have to monitor for any potential angina, any chest pain we might be getting, and those signs will tell us, okay, that's enough for today. Let's break it down. Then we come back a couple of days later and we do a little bit more. We walk a little bit further, or we use the exercise bike a little bit longer, and by doing so, we're gonna be able to challenge that heart a little bit further. We're going to notice, again, I didn't get as much shortness of breath this time. I didn't get as much of the heart pain or the chest pain. There's a few different ways to measure So there's a few different ways that we can measure our exertion on aerobic exercise. The simplest and most basic way is to watch our heart rate. If our heart rate is going up, that means we're working our cardiovascular system and we're working those tissues a little bit harder. Generally, what we want to do for aerobic exercise is keep ourselves in the moderate range, and that's going to be somewhere between 50 to 70% of our max heart rate. You calculate max heart rate pretty simply, 220 minus your age. And is that an exact science? No, but that's been found to be fairly accurate. So 220 minus your age is your max heart rate. And if you're going to start engaging in aerobic exercise, you want to be 50 to 70% of that max heart rate. Probably starting out, if we're new to this, it's probably better to stay around that 50% range. As it starts to get easier, as it starts to help us, we start to feel better, we can start to increase that heart rate. We can start working up in that 60, 70% range. To measure that, we can use the heart monitor, and a lot of folks recovering from heart issues are encouraged to use a heart monitor and track their heart. That's how you pace yourself. If you're new to exercise, pacing yourself can be a difficult thing. I don't think you always have to. My personal opinion, I think if you're in tune to the way you're feeling, I think if if you're asking yourself, do I feel like I'm working at a moderate pace right now? You probably are. Most people are pretty good if they stop and just ask themselves how they're feeling. Do I feel like I'm working out at a vigorous pace right now? This is really hard. Well, chances are my heart rate, if that's the way I feel, my heart rate is probably getting on up past that 70% range, and I'm probably going into more vigorous or more higher intensity physical activity. So it's good if you want to get a heart rate monitor. To me, I get frustrated. If I'm exercising, I don't want to stop every so often to check, where's my heart rate? Okay, it gets frustrating to me. But if you learn how to just kind of ask yourself those questions, how am I feeling? And do it often. Ask yourself how you're feeling. And once you ask yourself those questions, how I'm feeling, you can pretty accurately and test yourself. So I feel like I'm moderate. All right, let me take my pulse and see how right I am. Yep, I'm right at about 60% of my max heart rate. And what you'll find is by doing that a few times, you'll start to be able to really get really good at self-assessing where you're at on that range. We already mentioned this with the question earlier. What we want to know, and one thing you want to be aware of, and this is I think to some extent common sense, but we start slow, but if our goal is to load our cardiovascular system for the purpose of healing, so again, as I start to exercise, what's going to happen? Some good things are going to start to happen. One, my bad cholesterol levels are going to go down. My good cholesterol levels are going to go up. Exercise consistently lowers bad cholesterol and consistently raises good cholesterol. So my HDLs are going up. Why are good cholesterol, why is it good? Well, it's good because good cholesterol is larger, has a tendency to attach itself to the bad cholesterol and move it out of the way. Good cholesterol clears out the plaques. So if I've got a cluster of bad cholesterol forming a plaque in one of my arteries and I start to exercise and my HDL start going up, I've got more HDLs in that bloodstream that can start to clear out those bad cholesterol particles, and I start to have more room. As I start to have more room, guess what? Now I'm taking the thumb off the end of the water hose. I've got larger, more spacious blood vessels. My heart isn't having to work as hard. My blood pressure goes down. As my blood pressure goes down, and as I'm loading my heart with this aerobic exercise, my body starts to actually get in there and it starts to work through this healing and remodeling phase of potentially damaging, correcting those damaged heart muscle, that myocardium, those heart walls. It starts to repair those. If we continue to watch, so if I'm starting out and starting out, I can walk at a certain pace for 20 minutes and I can go this amount of distance in this time. In 3 months, let's say I can do that same workout over that same 20 minutes, but I'm going 3 extra blocks because I'm able to walk faster now. What's happening is we're getting a stronger heart. Our heart is pumping blood more efficiently. It's getting oxygen to those muscles more efficiently. And as you see yourself doing that, as you see yourself going further in the same amount of time, or you see yourself being able to exercise for longer periods of time, getting that 20 minutes up to 30 minutes, that 30 minutes up to 40 minutes, what's happening, you can tell yourself and know this and feel good about the fact, hey, you know what? I am actually repairing my heart. I'm actually repairing my blood vessels. Your body will go in and fix the lining of blood vessels where it's been damaged by those inflammatory particles. It's been damaged by that high blood pressure. Your body is capable of healing that, and it will. It needs us to load the system to get that healing to take place. All right, so effective exercise should follow basically an arc. So if we're exercising, we're going to start engaging in aerobic exercise. We want to have a gradual ramp up. That's a warm up to get our muscles warm. That reduces our chances of injury. It makes exercise safe. If we're going to tax our heart, let your heart get used to what you're doing. Have a slower pace of walking for the first 2 or 3 minutes. That's our warm up. Get the heart on board. Hey, we're doing this, heart. Get ready. Here we go. That makes it safer for you. That makes your exercise more effective. We also want to get the cool down at the end. So I've gone at what I consider to be a moderate pace, and I've done 30 minutes today. I did good. I'm done with my 30 minutes. I don't stop and sit down right then. I want to gradually slow myself down over a period of time I want to gradually let my heart rate come back down over a period of time. And once my heart rate is settled back down a little bit above that resting rate, maybe we're down around about 50%, 40% of our max heart rate, then we're going to sit down and we're going to maybe do some deep breathing and we're going to relax a little bit to allow that full cool down process to take place. Now, expanding on this idea of a cool down, and I know I'm running out of time, but expanding on this idea of a cool down, I think that needs to be a larger concept. If we're exercising to strengthen our heart because we don't want our heart to have to overwork during daily activities, that's the whole purpose. The whole purpose of exercise isn't just to load our heart, it's to load our heart so that our heart heals and gets stronger so that then my heart doesn't have to work very hard for just during the day. If I've got a weak heart and I've got a poor cardiovascular health, my heart is overworking all the time. And that's what leads to issues. That's what leads me to have more and more problems. If I'm going to have a stronger heart, then I need a heart that can ramp up and get to that top level of activity, but I need a heart that can come back down. So I've had patients and I've had people in the past who are actually pretty good at exercising fairly regular and engaging in physical activity. I've actually had patients who stay busy all day long, and yet they have poor health for their heart. Some people never come down. They're stressed. They're anxious. They feel like they have to keep themselves going at 2/10 the level all day long. That person is going to die faster than the person who sits on the couch all day long. The purpose of exercise is to teach our heart, teach our system how to go up so that it can come back down. So then when we're resting and we're relaxing and we're breathing, our heart rate is slower. And so that our heart is not taxed during the day. We strengthen our heart so that our heart doesn't have to work very hard. That's what lets us live for a long time. Just a quick parallel on that. If I've got a patient who I can't get to relax and I need to move their knee, but they're so scared I can't move it because they're guarding, I use this technique. It sounds fancy. It's not. It's called proprioceptive neuromuscular facilitation. It sounds fancy. Yeah, it sounds fancy. It's pretty simple. It's pretty simple. All it is where that person is tense, those muscles that are tense, I have them contract them as hard as they can. I have them push as hard as they can for about 8 seconds. All right, you want this muscle will not relax for us. So go ahead and contract it really, really hard for 8 seconds, and now stop. Now the muscle's fatigued. Guess what happens? It relaxes. All right, now I can move your knee. So I challenged that muscle, really challenged it for the purpose of getting it to relax. That's what we're doing when we're exercising our hearts. We're challenging our muscles. So what is my point? What am I challenging you to do? Exercise and then stop and breathe and deep breathe and allow your heart rate to come down. Allow yourself to release tension. If you can use exercise to drive down your stress levels, then exercising is accomplishing its purpose. You don't exercise to keep yourself tense. You exercise to keep yourself from being tense. All right, flip it. All right, I'm going to finish with this. So there's several different reasons why people can start an exercise routine and they fall off. It happens. Life events happen, they get us off track, and then it's hard to get back on. We lose motivation sometimes. I think we have to monitor, we have to watch the good things that are happening and really be in tune with that. It's good to journal and keep track of what's happening because that helps keep us motivated. Look, don't get obsessed with what the scale says or that sort of thing. That is not the end all be all. Watch how well you're moving. Watch how good you feel, how much better you're sleeping at night. There's several different good things that'll happen to you as you start to exercise. If you're overly obsessed with one little aspect, then sometimes it's easy when that one little aspect isn't going exactly the way you want it to lose motivation and fall off. look at all the good things that are happening. The purpose of exercise isn't to get the scales to say a certain thing or to fit in a certain dress size. It's to be healthy. It's to move good and to live for a long time and to live a high quality of life. Now, one of the main things that I see in my line of work when people are trying to exercise, I see these people all the time. They come in, hey, my back's killing me, my neck's hurting, my knees are hurting. Okay, well, what's going on? Well, I started trying to exercise. And it's sad because people have the right mindset. They want to do something. They want to be proactive. They've maybe just received a diagnosis of coronary artery disease. Maybe they had a heart attack. Maybe they had to have a stent placement or somewhat, and they want to do the right thing. They want to exercise. 2 months in, their knees killing them. Their back's killing them. They can't exercise. Or it's really getting really hard to exercise. For that purpose, what we need to do, so we have to have that cardiorespiratory exercise to challenge our heart, but we need other types of movement. We need other types of exercise. Don't just do one thing. Don't just go in and say, all right, I'm walking every day for my heart. That's great, but we need to do other things. And the other thing that I would really challenge you to pay attention to is functional movements. Sometimes we get the wrong idea of what exercise is. Exercise isn't just going to a gym and going through some machines and going to a treadmill for a period of time. Exercise is challenging all the components of movement. Going through this pretty quick. All right, go ahead.
Just a quick question. When doing the exercise, what would be a better time? Morning, afternoon, evening, late night? What is the optimal time for individuals? Is it just a case-by-case basis on the person?
Yeah. To some extent, it's on an individual basis. There are morning people and there are evening people. And it may be the case that the person who's not a morning person may not need to try to exercise in the morning. So there's an individual concept to it. The ideal situation, yeah, morning is good. Morning is good. You have to be somewhat careful with evening exercise because if we're too late in that, if we ramp up the body's systems too close to bedtime, it interferes with our ability to sleep. If we interfere with our ability to sleep in terms of quantity or quality, then the sleep isn't able to do its job of clearing the stress hormone. Without clearing that stress hormone, our inflammatory markers remain high, and then we feel bad the next day. We don't feel like exercising, and we don't feel like eating right. Sleep is essential. So the only thing about evening is I would be really careful to make sure it's not so late that it's within the last hour or two of going to bed, because that's going to interfere with your ability to sleep. Morning is ideal if you can do it, but again, it doesn't have to be. Yeah, whatever works best. I can't exercise. I gotta work too early in the morning to exercise in the morning. I would love to. I am a morning person, but exercise usually is in the evening for me, probably before bedtime. Yeah.
You said that the best exercise is the full body exercise.
Yeah.
So, okay. So if you have bad knees, I have seen the little exercise thing that you can put under your desk.
Yeah.
Is that beneficial or not?
It is. Yeah. It's a what I would say is that is a great starting point. Yeah, that's a good place to start. Say, all right, I want to exercise, and even I want to try to get some movement in while I'm working at my desk. I'm gonna move my feet. Yeah, and the question that we got to ask ourselves, and that you need to ask yourself, is when you're doing that, is your heart rate going up? Because if it's not, then you're not actually doing quite enough to get into that oxidative energy production. You're not actually doing enough to load the heart. So if our goal is to strengthen our heart, then we got to load our heart, and we know for loading our heart as to whether or not our heart rate goes up. So get an assessment of your resting heart rate, get an idea of what that is, and then when you start moving the feet and you start using this pedaling system you've got, after you've been doing that for 5-10 minutes, check your pulse, check your heart rate. And if you notice, yeah, that's faster, then yeah, absolutely, that's good for you. You are loading the heart. And that's a starting point. So if, and let's say it's difficult to do, long distance walking because of bad knees, but something like pedaling or a bike is beneficial. That device under your desk is good, but I'd even say, hey, go get access to, or find somebody to get access to a bike that allows both the arms and the legs to move, because then it's going to be much easier for you to really drive that heart rate up, or something like a new step machine where you're moving the legs and the arms together, because that movement of the feet, if they drive your heart rate up, eventually if you do that enough, it's not going to anymore. Your heart's going to get strong enough to where that's not enough to load it, and that's when you're going to need a little bit more.
Thank you.
Yes, ma'am. So again, finishing real quick, I don't want to go. Functional movements, folks. Pay attention, and I could spend hours talking about this, but I'm going to do it right here in 2 minutes. but can you get up and down from a low seat? Do you have to use your arms? Can you get up and down from the floor? Can you go up a flight of stairs? Can you go up a flight of stairs without a handrail? Can you do an outdoor hike on uneven terrain? Functional activities, if you challenge yourself, so let's say I've got bad knees and my back is an issue, part of your exercise needs to just be, I have a hard time getting up from a seat. When I get up in the morning, I'm sort of bent and I'm stuck. That's a functional movement challenge, and if we're going and we're trying to exercise and I have those types of movement challenges, injury is inevitable. So if you have a hard time with movement, you have a hard time getting up from a seat, you have a hard time going up a flight of stairs, unfortunately, I've seen it, if you don't start to address those issues, so what is an exercise for that? Okay, well, it's hard for me, really hard for me, and it hurts my knees to get up from a low seat, so I'm going to take a high seat. And I'm just going to go 10 times, and I'm going to do that a few times a day until that gets really easy. Then I'm going to go down some. I'm going to lower that stool down to a medium level, and I'm going to start working on getting up from that level until that gets easier. Then I'm going to go to a low seat until that gets easy. When that gets easy, hey, guess what? I'm going to have somebody here that can help me the first time I try this, but I'm going to see if I can transfer down to the floor. Maybe I use something to hold on to, and I get myself back up. Challenge yourself to be a better functional mover. And if there's something functionally, I can't go up a flight of stairs without a handrail. All right, well, let's find out why. We need to challenge our balance. We need to challenge our endurance. We need to challenge our strength. So that's something that we tackle. That's something we get better at. The better you move, and the easier it is for you to move, the less likely you are to get injured, the more likely you are to be able to participate in exercise and enjoy exercise. If you're a high-level mover, or you train yourself to be a higher-level mover, you will enjoy exercising. If you're not a high-level mover, if your movement abilities need to improve, exercise is not going to feel good. And it's going to be hard to motivate yourself to do it over and over. So I need to start doing it because I want my heart to be stronger. So I need to walk, but I'm not just going to walk. I'm going to do my sit to stands today too. I'm going to do my floor to stand transfers today too. It might just be I need my core to be stronger to get up and down out of the bed. So I need to practice just simply. This is an exercise, believe it or not. I do it with patients all the time. I'm going to lie down on the bed and I'm going to transfer myself up to a standing position. So I got to use my whole core for that. I got to use my legs for that. And I'm going to say, let's do that 10 times. So when a person comes in, they say to me, yeah, I can't get up and down from the floor. I need help getting up from this chair. I said, well, that's something we need to work on then. We need to get better at that. I want you to be a higher level mover so that you can live, so that you can be healthy. And there's research into this. They've done this. We're simply just analyzing how well a person gets up from a seat is a deciding factor on how long they're going to live. Believe it or not. That sounds way too simple, but it's true. So challenge yourself to be a high-level functional movement exercising person, and then you can exercise without getting injured. Any other questions? I know
I actually have a question
all right.
for you.
Yes,
You keep
ma'am.
using the number 10. Is there a basis for that? I mean, if someone did 5, right,
Yeah.
is that still helpful, or is 10 the optimal number?
Yeah, 10. I use 10 all the time, so that's the number that pops in my head. But yeah, 5 is good too. Yeah. So getting up from this stool 10 times, that sounds really daunting. Okay, do 3. We can start, you know, if you get to 10 and then 10's easy and you go on to 12, 15, well, it's time to drop the chair down lower. Let's drop back down to 5 reps and drop the chair down lower. So yes, good question. Sometimes, you know, if I really want a person to move better, I'll say, if I say 10, they don't move very good because they know I got to do 10 of these, I got to conserve. All right, you're not moving good, so I'm going to tell my patient, let's do 2 of them. But I want us to do really good with these 2. Then all of a sudden you see the person move better. So sometimes lower reps is better.